Today, 247 people have tested positive for coronavirus out of 4,147 samples tested over the past 24 hours. This brings to 7,188 our caseload of those confirmed positive for COVID-19. Our cumulative samples tested so far stand at 180,206. Amongst the 247 positive cases today, 242 are Kenyans, while 5 are foreigners. Males comprise 164 and females 83. The youngest is a one-year-old infant, while the oldest is 100. That's, I guess, this is the oldest we have seen so far. The cases are distributed in the counties as follows: Nairobi 153, Mombasa 35, Kajiado 15, Busia 12, Kiambu 12, Uasin Gishu 4, Machakos 4, Garissa 4, Muranga 2, Nakuru 2, Siaya 2, Lamu 1, and Nyamira 1. The distribution of these cases by sub-counties: if we take Nairobi, the 153 cases are in Kibra 35, Westlands 28, Dagoretti North 16, Kasarani 13, Embakasi East 12, Starehe 10, Langata 8, Makadara 6, Embakasi South 5, Embakasi West 4, Kamkunji 4, Roysambu 4, Dagoretti South 3, Ruaraka 3, and Embakasi Central 2. In Mombasa, the 35 cases reported there are from Mvita 17, Likoni 6, Changamwe 4, Kisauni 3, Jomvu 3, and Nyali 2. Kajiado reported 15 cases, 10 from Kajiado East, 4 from Kajiado North, and 1 from Kajiado Central. Busia had 12 cases, 8 from Teso South, 2 from Teso North, 2 from Matayos. In Kiambu, the 12 cases are from Kiamba 6, Ruiru 3, Thika 2, and Kikuyu 1. In Uasin Gishu, the 4 cases are from Ainabkoi 2, Kapsaret 1, and Tarbo 1. In Machakos, all the 4 cases reported there are in Athi River. And in Garissa, we have 2 cases from Dadaab and 2 cases from Garissa Township. In Muranga, the cases are from Maragua and Kiharu. In Nakuru, 2 cases are in Nakuru West. And in Siaya, the cases are in Alego Usonga, while the case in Lamu is from Lamu West. Nyamira case is from Nyamira Town. And I believe Nyamira County is the latest addition to the counties now affected by coronavirus. On a positive note, we're happy to inform you that we have discharged 39 patients from various hospitals, bringing to 2,148 the total number of recoveries. And once again, we take this opportunity to thank our healthcare workers for the good work they are performing out there. Sadly, we have also lost 2 more patients to the disease, bringing to 154 our total fatalities in the country due to COVID-19. Our heartfelt condolences to the family and friends of the departed. I would now want to invite to the podium Dr. Onyancha, who heads our Directorate of Preventive and Promotive Medicine, to come to the podium and say a few words about the cancer program and the documents that we are launching today, which we shall do so after we finish with this session. Dr. Onyancha.
Thank you so much, CS, for this moment. And good afternoon, everybody. The chance I've been given is to elaborate on the documents that we are launching today. We are launching the policy, cancer policy, and a pilot report for breast cancer screening, which has been elaborated by our CS. I just want to add a few points to that. Why the cancer policy? I think all of us are aware that last year we had a lot of outcry on the extent at which cancer was affecting our people. And despite that we are responding to COVID, other work is going on because the cancer treatment is also very key to us. And therefore, these are the documents that we have been developing. And I just want to give a just slide overview of the policy. Why the policy? This is a blueprint on what we are going to, how we are going to intervene in terms of cancer management in the country. And we have heard that this policy aims specifically to improve awareness and education to cancer prevention and control. We are all aware that the best management of cancer is prevention, because the treatment, usually the outcomes are not very good. So the policy spells out how we are looking at how we can improve the primary prevention of cancers through mitigation of risk factors and their determinants. That is one of the things that the policy is spelling out. The other one is to enhance access to appropriate cancer screening services. As I've already mentioned, that the best management for cancer is actually prevention, and also strengthen the referral pathways for patients with cancer or those suspected to have cancer. Also, the policy spells out how to promote access to optimal diagnostic treatment, palliative care, and the survivorship of cancer patients for in the unfortunate event that we have missed them in the screening and they have been able to get the disease. So we need to strengthen the management, the diagnostic treatment, and the palliative care. This is the supportive care for those who are terminally ill. Lastly, to strengthen the registration of cancer. At the moment, we don't have a very elaborate registration. We want to look at surveillance and the information management as far as cancer is concerned, and also promote the coordination, partnership, and financing of cancer control. It is important that we get such guidance so that we can be able to mitigate against the effects of cancer in the country. And therefore, the policy shall be implemented in line with existing national policies, alongside and also legislation through the 5 national cancer control strategies that have already been spelled out. I also want to mention that the report of the breast cancer screening was necessitated because of what we observed, that we have we have screening tools, but yet the uptake is not very good. It was done in Nyeri as part of the pilot county for UHC, and the report that has come out is showing that for sure we have those mammography in every county, especially county referral hospitals, but the uptake is very, very poor. And I want to appeal to the ladies concerned to please take up this opportunity to be able to go and have screened so that we can be able to detect the cancer early. As we heard from the speech, from the brief, is that breast cancer is #1 cancer among the women, and therefore we really want to make sure that we reduce it to that manageable stage. So these particular results that we are launching today, the pilot results, shows the following in brief: that 50 community health volunteers have been trained, and 50 community health extension workers with 33 healthcare providers having been trained in the breast cancer screening. What we are saying is that the caregivers are there, the providers are there. Please take up the service, especially at this point when we are seeing most of the services utilization is decreasing. We are appealing that the ladies should be can come so that they can be screened. I just want to take this opportunity as we finish to appreciate our partners for making it possible for this report and the policy completion. We have our partner, the network of the cancer organization, whom has already been appreciated. We want to also appreciate the General Electric for supporting us to make sure that we have the diagnostic equipments in the country, especially the one that is coming up in KU. We also want to appreciate our partner Chai for supporting in the HPV, as we have already had. Ours is to appeal to all the public that when the ministry is making efforts to make sure that the services are available, please make use of them. That is when they can only be meaningful. Thank you so much.